I think the biggest challenges that people face is themselves, right? Being able to look within themselves and decide, I need help, right? And to ask for help is a big deal. And so that's the number one challenge, is just admitting I need help. Once they do that, if we can get them help quickly, that is probably the number one thing that is going to change the trajectory of where we're going as a society and mental health in general. Because the problem is, once you decide, okay, maybe I need help, and maybe there is something that could help me, when they can't get it quickly because of whatever reason, it just sends one more person that's maybe going to stay stuck in their own emotions that they don't have to stay in. I've been a therapist for 32 years. Probably didn't have my first veteran until probably 10 years into it, so probably about 22 years. They definitely don't want to talk to me because I'm not a veteran, right? And so, I mean, they will eventually, and we do have, because I have some veterans that have referred other veterans to me and they trust each other, will talk to me. But let's face it, initially, veterans want to talk to their own, and they also, there's a lot of pride. Most veterans do not want, well, like general humans, right? We don't want our stuff shared, right? We don't want our personal things. We don't want to have to talk about things that hurt us or bother us or scare us, or where we feel sad or depressed. We don't want to talk about that. No one does. But veterans even more, they've been taught, I mean, it saved their life to not have emotion, right? To just move forward and do the next thing they had to do. That possibly saved their life. And now they're gonna talk about their emotions and sit in that and think about those things. I mean, that's overwhelming. So they definitely, without a lot of effort, like a lot of times it's a wife saying, like, I'm not staying with you unless you go to therapy. And they come and they're like, look, this is not gonna work, and my wife's probably gonna leave me, but I have to at least check the box and try because I really wanna stay with her. So first of all, if they go to the VA and they ask for outside help, like, I want to see someone besides the VA, they're usually pretty much forced to seeing somebody at the VA first, a few times. And that could take quite a few weeks, if not months. But let's say they get in a few weeks and then they say, no, I still want to see someone else. It is a process of, I mean, one veteran said, well, if you get the right person on the phone and you're patient, you can get some help. The problem is, how many veterans who are in crisis, who have already jumped through some hoops, are going to be patient to get the right person on the phone, right? I mean, one of the veterans that came to me through the VA said, I need more therapy now because of going through this process just to get therapy outside of the VA. And he said, it was almost humiliating to try to ask for help outside of the VA. Well, it's extremely important. If you think, first of all, this person has probably struggled for a while before they have even picked up the phone. Well, the person has struggled a while before they even acknowledged that they need help, and then that they've acknowledged that maybe there actually is help. Because a lot of times veterans, hey, there's not help for me, for my issue, there's not help. But once they say, okay, maybe there is help for me, if you don't get them help, quickly, that's where you've seen suicides, in the parking lots, right? And because they can't find timely care. The other thing I just thought of is the fact that it's so important for veterans to get timely help because it's not just about them, right? Most of them have a family. If they're not married, they have a mother or sister or brothers who are also suffering as well, right? Along with the veteran, because no one wants this person to hurt. Their children are suffering. So it's not about just the veteran getting help, it's the whole entire family. And when you have a community-based health system, you have more, there's going to be somebody for the family, there's going to be something for the children. And they can pick certain specialties or modalities that are gonna help them. They have more options. And let's face it, they haven't had a lot of, many veterans have not had a lot of control about where they go, where they're deployed, what they do. They're following orders. So it's also really important for them to have choice when they are dealing with their own mental health. And we have quite a few right now seeing us from the VA. And so I said, yeah, remind me what your story was, like going through the VA, what happened. And for him, he was absolutely suicidal. In fact, the VA, he had not gone back to the VA because he just felt like it wasn't helping. And the VA, when we pulled his records, the VA had tried to reach out to him 3 different times, didn't get him. And even though the last time he was there, he had expressed suicidal ideations, right? So he finally came to us, and he came to me from quite a ways away. Like it's not local. He came from, they had to drive quite a few hours to get here. And his wife is the one that found us, not him. And he was basically ready to give up. And so we actually saw him without the referral from the VA because it was going to take too long. And right now he is with his wife running, he runs like a retreat center, or helps with a retreat center for other veterans in another state now. So it's interesting because it's hard to imagine a law like that, because right now they have to jump through so many hoops. It really is. It is difficult. And so a lot of times we will take them without, we have the ability, limited ability to take people and not even have that veteran referral. We have limited ability to take veterans and not even have that referral, just because we don't want them to have to wait so long. So it would be, we would be able to serve a lot more veterans if they actually were able to pick up the phone and find care. People understand, when people see a veteran and they're out, walking around and they are missing a limb, or I've seen them with patches on their eye, or they have some physical ailment, that's understood, right? Wow, you sacrificed. Thank you so much for sacrificing. But the hidden PTSD and depression and the family alienation that maybe comes when they get back because of what they're dealing with, the emotions that they're dealing with that they can't share with anybody, and they don't know how to express to their family. That's people are much more reluctant to understand that, right? They just say, oh, it's, move on, or they just don't understand the depth of despair that some of them are feeling because they followed orders. And they thought they were doing the right thing and came home and realized that they wish they hadn't, but they didn't. But they also don't know what they would have done differently. I laugh because initially I didn't want to serve veterans. Like I thought I can't do that. Like I don't know how to help them initially. And actually I had a first responder, a police officer that I was helping, and he had a friend that was a veteran, and he asked me would I see him, and I said I don't know how much I can help, but I will, right? And we had just been trained in some very specific PTSD protocols, and started working with them, and you saw the change. We started working with them with some newer PTSD protocols, and we saw the absolute change. And then they started referring other people. And I will tell you, it was really interesting because after working with quite a few veterans, I sat down one day and was reflecting because my grandfather was a veteran, and towards the end of his life, he tried to take his life. And it was so confusing. He also tried to attack my grandmother in the middle of the night, right? And later, and I didn't know this till way later, but when he visited the war memorials with my dad, he just stood there and sobbed. And my dad, and I remember thinking I wish I could have helped him not have so much pain. And so, didn't know that was coming. But yeah, no, he worked really hard. And I know we don't know a lot of the stories about him because he couldn't share a lot of them. I do know he was in a foxhole, and the guy next to him died because he came home, and we heard that story very little, but he also, would say, like, you know, value your life. Like, you don't, each day is, you know, do something good each day. So anyway, that was, I wouldn't want people to suffer like he did. Well, I would tell them, and you can go interview him next, but I would tell them that my 102-year-old friend, Mel Jenner, who was, his last mission was on D-Day, and he suffered with PTSD for many years, even with access to the VA, and didn't find healing until he was 97 years old. If he had had other options prior to being 97 years old and someone telling him, hey, you can go to these other places for counseling, I don't think he'd still be here today at 102. And he talks about his PTSD and how he doesn't have it anymore. So I don't know. I think, and the other thing that's amazing is once veterans get care, they can talk about what happened, and we can hear more about their journey and how there is healing, right, on the other side. Because if they're not getting help, they're not talking about getting help, and then it's just a spiral. I can't even think what the word is right now. When one gets help and shares that they've had help, it creates a momentum. And that's what we want, the ripple effect. We want the ripple effect of one getting help and then sharing with others. And because they're worth it, their families are worth it, and we need to value mental health.